DNP student that's going to be doing a physical assessment on you today. Can you tell me your name?
Jane Doe.
Hi, Miss Doe. Can you go ahead and have a seat for me here? So to start off our physical assessment, I noticed as you were walking in, didn't have any issues, no gait problems, looked to be that you're pretty well balanced with your posture, and appearance is generally good, don't have any hygiene issues that we see obviously. And can you just tell me what your birthday is?
4/22/79.
Okay, and tell me where you're at right now.
In the clinic.
Okay, and what month is it?
January.
Okay, great. So alert and oriented ×3 to person, place, and time, which is great. Don't see any issues there so far. Now, I'm going to go ahead and ask you a kind of a silly question that's going to be assessing your abstract thinking. Can you tell me what you would do if you were to be walking along a path and were to meet a mud puddle in the middle of it?
I'd probably go around it.
Okay, great. Good answer. So we'll go ahead and start and take your vital signs here, okay?
Okay.
We'll start with your blood pressure. And you can just relax that arm down for me. There you go. Okay, so your blood pressure is 110/84, and that is within normal range.
Okay.
Get this out of the way. And we'll go ahead and check your temperature here, okay?
Okay.
Just want you to place this under your tongue for me. So your temperature is 98.7, and that is also normal. Haven't noticed any fever or chills at home or anything?
No.
Okay. So the next thing that I'm going to do is I'm just going to go ahead and assess your pulse rate here. And just breathe normally for me, just however's comfortable, okay? So your heart rate is right at 87 beats per minute, and that is normal. And I also assessed your respirations while we were doing your pulse rate. And your respirations are 17 and non-labored. Don't notice any retractions or anything like that, so that's good. So the next thing that we'll move on to, just doing a good general appearance here, and noting that there is good facial and skull features, no deformities, and everything seems to be pretty symmetrical. So I'm going to go ahead and just take a look at your eyes and just observing on the outside. I don't see any problems. Eyes are symmetrical. Just going to pull down your lids a little bit here and taking a look at that conjunctival sac. I don't see any redness, swelling, or discharge. Sclera looks good. Now we'll go ahead and just assess for pupil reaction to light. So I've got a light here, and I want you just to look at my nose. And I'm going to shine the light briefly into your eyes, and I'm going to be watching for pupil constriction and how they react, okay? So just go ahead and just keep looking at my eye, or my nose here. And here we go. All right, we've got good reaction. Pupils are equal around and accommodating appropriately. So without the light in your eyes, your pupils are right at 3 millimeters, and they constrict down to about 2, and that is normal. What I want you to do is take a look at the pen light here, and then look back there at the wall for me. Okay, look back at the pen. Okay, and they are definitely accommodating appropriately. Now we'll go ahead and take a closer look at your eyes, and first we'll do a visual acuity test here. I've got a Rosenbaum chart here, and I want you to hold this about 14 inches from your face, and go ahead and cover up your left eye for me. And with your right eye, go ahead and read the furthest line down on the left side that you can.
428739.
Okay, great. So the right eye was reading right at 20/20. I'll go ahead and have you cover up the right eye, and we'll check the left eye. And go ahead, if you can read the same line, go ahead and read that line backwards.
987824.
Great. So didn't miss any. That also is 20/20. We'll go ahead and assess both of your eyes open. Can you read the same line there at the bottom?
428739.
Perfect. So 20/20 across the board. Looks like no visual issues with the visual acuity test. I'll go ahead and we'll turn this light out, and I'm going to take a look at your eyes a little closer through the ophthalmoscope. Okay, so what I'm going to have you do is just look at the spot back there on the wall for me, and just keep your eyes focused on that. I'm also going to be shining the light in your eye again, okay? So here we go, we're going to check the right eye. We've got good red reflex here, and I'm going to go ahead and get a little bit closer to you to see if we can see some of the internal structures, okay? Okay, good. So we'll go ahead and do this left eye. And again, here comes the light. Good red reflex there. Try to get it a little bit closer to see if we can see any of the internal structures, but lighting does not allow us to see very good back there. Go ahead and get the light back on. So now I'm just going to go ahead and assess your sinus cavities here, okay? And tell me if you feel any tenderness whenever I press on these areas. I'm going to be assessing the frontal sinus cavity here. Any tenderness?
No.
Okay. And so we'll move on to the maxillary sinus. Any tenderness here?
No.
Okay. So I didn't feel any swelling or anything, so that is good. Now I'm going to go ahead and take a look in at your nose, and I'm just taking a brief external exam here, and I don't notice any swelling, discharge, or anything out of the normal. We'll go ahead and take a peek on the inside using the light source, okay? Alright, so we're going to go up the right nostril here, and the internal mucosa is intact. No swelling, no redness. The mucosa is moist, and she does not have a deviated septum. Go to the left side here. And again, all the internal structures appear to be within normal range. Internal mucosa is smooth, and no abnormalities found. So what we'll do now, I'm going to go ahead and just take a quick peek at your hair here, kind of backtrack a little bit, but just making sure that we don't have any issues. Haven't had any balding or anything like that?
No.
Okay, so the hair looks to be within even distribution. Good, strong hair. Don't see any major breakage or anything, issues going on there. Now we'll go ahead and take a look at your ears. And just do an external observation here. I'll turn you around a little bit. All of the ear external structures seem to be within normal range. Don't have any obvious discharge. There's no redness in the external canal or anything that I can see. So I'm going to go ahead and take a look on the inside of your ear, okay?
Okay.
So I'm going to do that by pulling the auricle up and back and inserting the speculum. And you just tell me if there's any pain or tenderness with this. So right now I'm looking at the inner canal here, and it is clear of any cerumen, and I do see a good a good light reflex with a good pearly gray tympanic membrane that is intact. So don't see any discharge or swelling on the inside of the ears either. And again, just taking a look on the outside structures of this right side ear, everything looks good, symmetrical to the left side. Don't see any obvious discharge or anything. We'll go ahead and take a look on the inside. Again, pulling the auricle up and back. And I am able to see good light reflex. Once I got that canal straightened out, tympanic membrane again intact on this side, no bulging, no proliferations, and no swelling within the internal canal or discharge. So ears look good. Next thing that we're going to do is just do a quick little whisper test. Just kind of test that hearing a little bit. And what I'm going to do is I'm going to say either 2 numbers or 2 words, and I'm going to stand behind you, and you tell me what those are, okay? And what I need you to do is to stick your finger in whichever ear we are not testing and just kind of spin it around on that tragus area there a little bit, just to make a little bit of noise, okay? So we will first test the right ear. So go ahead and plug in the left ear.
Boy 3.
Okay, good job. And we'll go ahead and do the left ear now.
Tom 4.
Good job. So you got both of those correct with the whisper test. The next thing that we'll move on to is just taking a look at your neck and the structures within it. So just looking at you here, I can tell that there's no obvious tracheal deviations or anything. So I'm going to come behind you here and just palpate for our thyroid gland. And I don't notice any swelling, bulging, or anything that's asymmetrical. Are you having any pain or tenderness when I
No.
do that? Okay. I want you to go ahead and swallow for me. Okay. And we had good, even, symmetrical movement with the thyroid as you swallowed, so that's normal. What we'll do now, I'm going to go ahead and palpate the lymph nodes within your neck area, and you tell me if there's any tenderness in any of these areas, okay?
Okay.
So we'll start with the pre-auricle area. Any tenderness there?
No.
Okay, so no swelling. And post-auricle, any tenderness back here?
No.
Okay. And how about in the occipital region back here? Any?
No.
Okay. Alright, and so we will check under here. Any swelling?
No.
Any pain whenever I push? No swelling that I've noted. So we'll check the superficial clavicular areas here. And I'm not feeling any swelling, any tenderness as I press?
No.
Okay. Any tenderness here?
No.
Okay. And go a little bit deeper here for the deep cervical lymph nodes. Any tenderness in any of these areas?
No.
Okay. No swelling, that's good. So we'll go ahead and check the supraclavicular area here. And no tenderness in any of these areas?
No.
Great. So we'll go ahead and continue on and do some palpation of the lymph nodes that are in your upper arms. But first I'm just going to go ahead and do a quick little overview scan of your skin with your arms, and I don't see any obvious issues. Temperature is warm to touch, and just going to go ahead and palpate both of your radial pulses here. So radial pulses are even and 2+ bounding, so that is normal. Just going to go ahead and check the cap refill on your right hand here. And cap refill is less than 3 seconds, so that's great. We'll check it on your left hand here. Cap refill again is less than 3 seconds. So I'm going to have you raise this arm up for me, and I'm going to feel the lymph nodes, the central lymph nodes here. Any pain in this area?
No.
Okay. Now I'm just going to kind of let your arm relax a little bit. How about in the lateral area here?
Mm-mm.
Okay. I'm just going to check in the subscapular area. No tenderness?
No.
Okay. And also through the pectoral area. And no tenderness in this area? Okay. And I did not feel any swelling or any nodules. So we'll do the same thing on this arm. Again, checking in the central area here under the axilla. And no pain or tenderness?
No.
Okay. Just relax it a little bit here for me. Through this area? Any tenderness or pain?
No.
Okay. We'll check back here. Any pain or tenderness?
No.
Okay, great. And again, let me just check along pectoral area. And no pain or tenderness?
No.
Okay, awesome. So again, I did not feel any nodules or any swelling with any of the lymph nodes that we've assessed so far. And now what we'll do is go ahead, just have you turn around for me, and we'll take a look at your posterior thorax here. So I'm just going to do a quick inspection, noting that there are skin is intact, warm to touch, and I don't see any obvious issues. You've got a little mole up here. Is that something that you've had for a while?
Yeah. For
Any
years.
changes in it?
No.
Excuse me. Okay, good. So we will go ahead and just going to kind of feel for our structures here. Just make sure that there's no issues. Just kind of give me a quick little shoulder shrug, just so I can check out the muscle tone here. Okay, and just relax. And just going to feel for our spinous process here throughout the back. And it all seems to be within alignment. Now, the next thing that I'm going to do is I'm going to do some tapping with my fingers in different areas of your back. And I'm going to be listening for different sounds, okay? So I'm just going to go ahead and percuss areas of her back. So when I do this, I want you to take a deep breath in, and I'll let you know when to exhale, okay? Exhale. In. 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 Exhale. So I didn't notice any abnormal sounds when we were doing the percussion. So I'm just going to go ahead and listen to your lungs, okay? And similar with the percussion, I just want you to take a deep breath in. I will listen and then tell you when to exhale, okay? Take a deep breath in. Exhale. 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 And deep breath in. Exhale. So your lung sounds are clear bilaterally throughout each of your lungs. And I did want to go ahead and mention about our AP diameter, how it clearly is 2 to 1. Don't have any official measurement or ruling instrument here, but you can definitely tell that our diameter from the posterior is definitely double that of from the lateral side. I'm going to go ahead and check you for CVA tenderness here while we're in this position, okay? So what I'm going to do is just place my hand on your back in an area and kind of give a little thud, and you tell me if you have any tenderness, okay?
Okay.
All right.
No.
Any pain? Okay, we'll check this side. And any pain?
No.
Okay, great. Now I'll go ahead and have you turn back around to the front for me. And we're going to just take a look at the anterior chest here. Again, just looking at the skin in here. Don't notice any abnormalities. Skin is warm to touch, good color, and again, I'm just going to listen to your lung sounds from the front this time, okay?
Okay.
And I'm going to have you breathe in, and I'll let you know when to exhale. Go ahead and breathe in. Exhale. 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 And breathe in. Exhale. Great. And again, breath sounds are equal and clear bilaterally. I'm not hearing any adventitious breath sounds, and I don't notice that you're having any difficulties with breathing. Was that hard for you in any way?
No.
Okay, great. So now I'm going to go ahead and do an assessment of your heart, okay? First thing that I'm going to do is I'll move over here so we can see. I'm going to place my hand at the 5th intercostal space at the midclavicular line, and so what this area is the point of maximal impulse. So this is where I should be able to feel your heartbeat the best, and I'll be able to palpate for any abnormal thrills or heaves, anything like that, okay? So I just want you to breathe normally for me here. Okay, great. So I am feeling a good pulse, and I would probably put that about a 1+, just with the position that we're in. We're not able to get a really good assessment with that point of impulse. And I'm going to go ahead and listen to your carotid artery since we've already did the PMI there. I'm just going to do a quick listen to your carotid arteries. And so I'm going to listen with the bell so that we can see if there's any bruits or anything. Let me just go ahead and palpate those first. Okay, so we got a good 2+ bounding carotid pulse on the left side. Okay, now I'm going to go ahead and palpate the right side. Okay, great. So now I'm going to go ahead and listen with the bell of my diaphragm, okay? Okay, good. No bruits noted on the left. And again, no bruits on the right carotid artery. So continuing with the heart, I'm just going to listen to various places for your heart sounds, listening to the valves. I'm going to be listening for any murmurs or any bruits going on, okay? So I just want you to breathe normally for me. First place we're going to listen is the aortic valve. And I'm hearing good S1, S2 sounds. Don't hear any other additional sounds. Just going to listen to it with the bell here, just to make sure there's no bruits. Good. Now I'm just going to listen to the pulmonic valve here. Good S1, S2, not hearing any extra sounds. And I do not hear any bruits or any thrills. So the next place we're going to listen to is going to be Earp's point, and that's going to be the second pulmonic area that we're going to be listening to. Good S1, S2 sounds. I'm just going to listen with the bell. And again, again, I do not hear any extra murmurs or any bruise. So just going to listen to your tricuspid valve here. Good, S1, S2. Just going to listen real quick for any bruise. And no bruise there. Since we'd already palpated the PMI, I'm just going to take a quick listen to it here, okay? Okay, great. I'm hearing good S1, S2 sounds. Just going to listen for any bruise. And no bruise. Just for a moment, I'm just going to go ahead and get an apical pulse rate. We're going to check it for a minute here, okay? So your pulse rate was 84 whenever we listened at the PMI. So now what we're going to do is we're going to move on to the abdominal assessment, and I'm going to have you go over to the couch if you don't mind. Just go ahead and lay back for me and have your knees slightly bent. And I'll adjust the camera here. So with this abdominal assessment, I'm just going to take a quick look just while you're laying here comfortably, okay? I'm just going to pull your shirt up a little bit. We're going to take a look at your abdomen. Going to be looking to see if there's any abnormal structures, any concaves or any bulging or anything like that just from laying here. And everything looks good just from general appearance. Now what I want you to do is go ahead and lift your head forward for me. Just lift your head straight up. And so I'm looking for any herniations within the abdominal wall, and I do not see any, so that is good. What we'll move on to is go ahead and I'm going to listen to your bowel sounds. So I'm just going to listen in all four quadrants here, okay? Good active bowel sounds in the right upper quadrant. We've got good bowel sounds in the left upper quadrant as well. Good active bowel sounds in the left lower quadrant. And good active bowel sounds in the right lower quadrant. So now what I'm going to do is just palpate on your abdomen, and you let me know if there's any areas that there's any tenderness, okay?
Okay.
So in the right upper quadrant here, any tenderness?
No.
Okay. And moving to the left upper quadrant, any tenderness?
Mm-mm.
Okay. Left lower quadrant, any tenderness? And we're just doing light palpation here just to check for any tenderness. And how about the right lower quadrant? Any tenderness?
No.
Okay, so we're going to palpate a little bit deeper here, and I'm going to be feeling for any masses, okay?
Okay.
So, again, in the right upper quadrant, and again, just let me know if there's any pain or tenderness with this. No masses noted in the right upper. No masses in the left upper quadrant. no masses within the left lower quadrant, and no masses within the right lower quadrant with the deeper palpation. So what I'm going to do now is I'm going to do some percussion so that I can hear for any different sounds that are within the abdomen, okay? So I'm just going to listen here. Those are all normal, and we're just going to kind of listen to the liver here that is over at the costal border. Got a good dull sound over that liver. Well, I've got you in this position. Just going to take a listen to your aorta. We're going to listen for any bruits and going to listen into the renal arteries as well, okay?
Okay.
So we're going to listen to the aorta. And I did not notice any bulging or any pulsations just from doing the inspection. And I do not hear any bruits within the aorta. We're going to check the left renal artery. And no bruits in the left renal. Check the right renal. And no bruits. I'm going to have you straighten your legs out for me as best as you can. Get you covered up. And I'm going to feel for your femoral pulse, okay? So I'm going to have my hand right here. And I have a good 3+ bounding femoral pulse. I'm just going to check this other side here. And again, a good 3+ femoral bounding pulse. Just going to compare the two. And they are equal. And I'm just going to listen to the femoral arteries just to see if there's any bruits in them. Okay, great. So I did not hear any bruits within any of the arteries throughout the abdominal assessment. I'm going to have you set up here for me. And one thing that we would generally move on to at this point would be to do a genitourinary assessment. I haven't had any issues with using the bathroom as far as peeing or any burning, itching, anything like that.
No.
And as far as your menstrual cycle, are you pretty regular?
That's regular.
Okay. And so I'll go ahead and take this opportunity and ask you about doing monthly self-breast examinations. Do you perform those?
Yes.
Okay. And how are you doing those?
Usually after I get out of the shower, just feeling for anything unusual, and it's after my period.
Okay, great. Just definitely want to reiterate that you do need to be doing those every month after your period. And typically in the shower is a good opportunity, and also once you get out, if you just lay down and do an examination, then that'll definitely put you at good chances of finding anything abnormal.
Mm-hmm.
I don't need that right now. I'm just going to take a look at your lower extremities here. And so just doing a general assessment from where you had been walking around and sitting up and down, looks like you have good movement within the lower extremities. I'm just going to take a quick look here. And I do not see any obvious issues with any skin. Feet are warm and dry to touch. And so I'm just going to feel your dorsalis pedis pulse on both feet here. And you have good 2+ bounding pulses within the dorsalis pedis. So that's good there, even on both sides. Now I'm just going to check your posterior tibial pulse here. you've got a good 2+ bounding pulse that's even on both sides. Just kind of doing a quick little assessment here. Going to look over the malleolus, and I do not see any edema. No edema in further lower extremities or upper above the ankles. Now I'm just going to do a quick cap refill check. And capillary refill is less than 3 seconds on the left leg. And again is less than 3 seconds on the right leg. So I think this concludes our physical assessment. Thank you, Miss Doe.
Thank you.